We are joined now by Senator Pat Toomey from the great state of Pennsylvania. Senator Toomey, thank you for getting up early, joining us here. I want to start with thanks for being here. I want to start with some great work you've done. First of all, there are a lot of politicians that have not focused very much on the data itself in terms of trying to make smart decisions. And I got to commend you for being one of the politicians who's most focused on the data. I'm going to start with Little League, and then I'm going to work into some broader societal decisions as it pertains to sports and more. But you did a really interesting roundtable discussion about the return of Little League and why it can make a lot of sense. And as a part of that discussion, you said you've got a son, I've got a son. I would let my kids play Little League right now based on all the data that is out there. Would you let your kids play Little League baseball? Should it be back in many parts of the country this summer in your mind?
Yeah, I have a 10-year-old son, and we live in Lehigh County in eastern Pennsylvania. We are in a red zone, according to our governor, which means you're supposed to hide under your kitchen table and not go outside. Based on all the data that I have, I'd sign up my son for Little League baseball tomorrow.
Thank you for saying that, by the way, because your governor, Wolf, and I'm not an expert on Pennsylvania politics, but it seems to me that he has done a disastrously bad job. I got a couple of stats for you. I don't know if you've seen the AP report that came out yet, but the state of New York sent 4,300 plus nursing home patients who were COVID positive back into nursing homes, and it spread like wildfire there.
Yeah.
It seems to me the same thing is happening in Pennsylvania, where when I look at the data, over 70% of deaths in Pennsylvania have been in nursing homes. Why are we not protecting the most vulnerable in our society in Pennsylvania and elsewhere? And why are we allowing this shutdown to impact everybody when we know that the elderly and the immune suppressed are uniquely vulnerable to the virus?
You're exactly right. You hit the nail on the head. The great, huge mistake when we look back at this, when the history is written about this episode, the clear mistake will be allowing, and in some cases even requiring, that nursing homes accept from hospitals discharge patients who are coronavirus COVID-19 positive. That's what led to these massive breakouts at nursing homes. It's been absolutely tragic, and that was the big mistake. Now, I will acknowledge that when this outbreak was first beginning, we didn't know the dynamics very well. We didn't understand the nature of the risk. And so the extraordinarily draconian message of putting healthy people, putting everyone in quarantine, locking down and shutting the economy, I understood why governors did that. They wanted to prevent a universal outbreak that created so many sick people all at once that our hospitals would be completely overwhelmed. Okay, I get it. But it's been many weeks, at least 4 or 5 weeks here in Pennsylvania, that we have known for a fact that we're not going to overwhelm our hospitals, that this disease is highly concentrated among elderly people, and in particular, elderly people who are not well. Let's be honest, there's a reason people are in the nursing home in the first place. And so the focus should have shifted long ago, in my mind, to protecting those vulnerable people, protecting and safeguarding, having quarantines and isolation units for those elderly, vulnerable people with or at risk of developing COVID-19. And frankly, the rest of our society is at much, much less risk, with kids being at extremely low level of risk. And we should have made that pivot long ago, and we didn't, and it's very, very costly.
We're talking to Senator Pat Toomey. I got a couple of stats for you, and I want to give Phil Kerpen credit for them because he dove into the data. Pennsylvania has more COVID deaths from people over age 100 than under age 45. They have more deaths from people over age 95 than under age 60. More deaths from people over 85 than under 80. These are all public documents. Yeah. Why are so many people doing such a poor job of explaining this? Why is the governor of Pennsylvania insisting on a shutdown? Why are kids not able to play Little League baseball?
Yeah, it makes no sense. As I say, I understand getting the policy wrong at the onset when we didn't know how this disease would evolve. But now the data's out there. You just cited some absolutely eye-popping statistics. I've seen some of those statistics. the data is very clear about who is at risk to this disease, and there's some people who are at enormous risk. If you're 85 years old and you have emphysema, you better be very careful. But if you're 25 years old and you work at a factory, your risk is de minimis. If you're a kid, I mean, it's the ordinary flu season is at least 20 times more dangerous to kids under the age of 14 than COVID is, based on the actual data. And when have we ever decided, well, we have to ban Little League because of the flu season? I mean, it doesn't work that way. So,
sorry to cut you off, but that is an unbelievable
it's just time
stat.
that policy catches up. Oh, yeah, that's a fact. It's been the case. I mean, the number of fatalities among kids under the age of 14 from the ordinary flu is 20 times what COVID has done. And in the COVID cases, it's probably overwhelmingly kids who had some other complicating underlying healthcare problem. So just extraordinary. It's time for policy to catch up with the data.
Thank you so much for coming on the show. We're talking to Senator Pat Toomey and talking to my audience. You did your roundtable, and I pulled a quote because some people listening right now are going to say, well, kids can spread it to other people. And that's an argument that people make for why Little League couldn't exist, or frankly, why kids shouldn't be back in school this fall. But your doctor expert who was on this panel from Stanford University found, and I'm quoting from him, there is, quote, no evidence at all based on a study that he cited of any infections passed from kids to parents or other adults. Zero. Now, there may be some cases we can point to that say there is some. I can't say it is literally zero. There is always a possibility. What we can say pretty certainly is it is much less likely than the other way around, where adults pass the virus to kids. Some people out there would say, well, kids can't be out and about circulating in society. They can't be playing Little League because they'll pass it on to adults. But the data doesn't reflect that either, and I think that's a big part of the story that's not getting out there.
It's a huge part, because when parents get, if, and I hope they will, that parents can get over the apprehension of having their kids playing for the sake of the kids' health, they might still be worried about this transmission from the kids. But the data shows that it doesn't happen. Now, as the doctor pointed out, I mean, we can't predict with certainty the future, and we haven't tested every single possible example. But where they have done extensive studies, they have discovered, and there's been several countries and several studies now, that it doesn't get transmitted that way. And there is a logical explanation. I don't know if this is the only explanation, but because kids are so minimally affected by this virus, it seems to me reasonably likely that the viral load never develops to the level, to the concentration, to the intensity that enables them to transmit this. There has to be a certain quantity of this virus in a person in order for that person to infect someone else. And I think it's quite plausible that for the same reason that kids don't get sick and kids don't die from this, it could be that for the same reason they're very unlikely to transmit it. And that was an important discussion we had yesterday at the roundtable. And Dr. Bhattacharya is an expert at this from Stanford University. He's done this research, so I was really grateful for his input.
Well, it was fantastic work that you've done, and you've done a lot of these roundtables, and I'm glad you're coming on the show. I've been trying to share a lot of this data with my audience for the past couple of months as it has become more and more readily apparent. And sometimes I feel like I'm ramming my head into the wall over and over again as if people just don't listen or understand the data. Is this one of the most frustrating things to you in your political career, that the data seems pretty clear, and yet there's what I've been calling fear porn? People, it's like they won't use the rational side of their brain to analyze this data. They just want to be terrified. And frankly, there's a lot of politicians who are helping to magnify that terror.
Well, that's the problem. And the media, I haven't done a count on this, but I will bet you for every encouraging story about how limited this disease is, how we can overcome it, the progress that's being made, for every one of those stories, I got a feeling there are probably many stories that seem to be designed to scare people. So a person who's consuming information about this from the media, which is most people, right? Most people don't have the time to go out and actually do the research themselves. And so what they're hearing is all these scary stories, which can be extremely misleading. So it is very, very frustrating. It's part of the reason why I decided to do this series of roundtables, to get real experts who are actually looking at real data and let them tell the story directly, not being filtered by some media that might have an agenda.
Your governor complained because Ben Roethlisberger got a haircut. I wish that this was not a made-up story. This is 100% a real story. But, Senator, just so you know, I've been trying to tell my audience, look, I'm in Tennessee. I went and got a haircut. My gym is open. I'm going to the gym. I'm taking my kids down to the beach in Florida, which is also open. I'm trying to live my life in a way to reflect that I do not believe that my family or my kids or my wife or young and healthy are under danger, and we got to get the economy back up and roaring. But when I hear the governor of Pennsylvania, a guy who got elected by a huge state, right, when he's complaining about Ben Roethlisberger getting a flipping haircut, I almost lose my mind. What's your reaction when you see the governor of your state lecturing the quarterback about getting a haircut, something that has zero danger associated with it in that situation?
Yeah, I'm certainly very disappointed. I'm not sure exactly where Ben got his haircut, but I'm pretty sure he lives in the western part of the state. And there are huge, huge sections, especially in the central and western part of Pennsylvania, where the coronavirus almost never showed up. I mean, it's amazing how low the infection rates and the fatalities are, with the exception of a few isolated cases, including nursing homes. And so it's just not true that going out and getting your haircut is a very dangerous act. It's not. The governor, unfortunately, has all barbershops banned, activity banned right now, and that does not need to be the case.
If you were the governor of Pennsylvania right now instead of a senator representing Pennsylvania, last question for you, what would you do to change things?
Oh, by now, and it would have been some time ago, we would have progressed through a series of phases in which the economy had been reopened. The vast majority of the state now would be pretty much fully reopened, with certain caveats. Okay, I'm not convinced that we're ready to have concerts or thousands of people in a basketball stadium. There's a risk of a major transmission. I'd still be encouraging people to wear face masks when they're engaging with other people in the public. We could, I think we'd have some discussion about whether restaurants should operate at a somewhat lower level of density than before. But we're talking about the modest refinements to an open economy, and that's where we would be, because it's safe now, and we really should have started this process some time ago.
There's a huge number of Pennsylvanians that are listening to us right now. What would you tell them to do as they're listening to this data? And I think a lot of them, honestly, it's a jaw-dropping moment to hear all these things. When you say that a kid in Little League is 20 times as likely to die of the flu as he is of the coronavirus, and when they hear that they're not transmitting, kids aren't, the virus to adults based on studies, there's no reason kids shouldn't be out playing Little League. What would you tell Pennsylvanians and also other people around the country who hear this data and want things to change to do?
They've got to call the governor. They've got to call the governor and tell him that it's time. It's past time. They should call their state representatives. It's interesting, we've got a Democratic governor. We have a Republican House and a Republican Senate in Harrisburg in our state government. The Republicans are, I believe, unanimously in favor of moving ahead with the reopening, and increasing numbers of Democrats are also in the legislature. So if that number grows, at some point it gets to the point where the governor will either, however reluctantly, start to go along with the will of the big majority, or else he'll be overridden by the legislature. So I would encourage people to reach out to their state reps, their state senators, and the governor. The decision is in the hands of the governor, but ultimately it can be overruled by the legislature. So we need to use that political process that we have to get the right policy.
How disappointing, I know I said last question, but how disappointing is it to you, you just referenced political parties, that this has in any way become partisan? To me, I sit back and I say data doesn't have an R or a D in front of it. It's data. Yeah. Like, anybody can look at this, whether they're a Democrat, Republican, independent, whether they don't care about politics at all. Data is data. It's not complicated. The numbers that we're talking about make it really clear that not only Pennsylvania, but basically the entire country needs to be open. How frustrating is it to you that it's become political?
Yeah, it's very frustrating. For a moment there of, I don't know, 4, 5, 6 weeks, we in Congress, despite extremely polarized politics, let's be honest, but despite that, we were able to come together and pass unprecedented legislation that did major, major things to try to replace lost income and keep business alive so that we can get through this and come out the other side. And to a remarkable degree, we were able to come together and get it done. Some of the biggest legislation ever passed unanimously in the Senate and massively in the House. But I suppose it was just a matter of time before partisan politics crept back in. And now you're absolutely right. The issue of reopening the economy is seeming to fall under roughly partisan lines. But I do want to stress, in Pennsylvania, there's a bipartisan majority in the elected state legislature that wants to move forward. So that's encouraging.
Senator Toomey, I know you're a busy man. At Sen Toomey, I'll tweet out the link to your Twitter handle. I appreciate you coming on with us. I'd encourage everybody to follow his lead. He has been fantastic talking about real data as it pertains to sports and otherwise. Thank you.
And if I could just encourage people to check out the roundtable on YouTube that we did yesterday. I think they'd enjoy it.
Yeah, if you will send me that link, I'll make sure I tweet it out for everybody out there who's interested in Little League and the data. We'll make sure that it gets out to as large an audience as we possibly can. Thank you again, Senator.
Thanks so much.